Meet Fabrienne. Fabrienne might look like an average white woman in her late 30s, but she's not. Fabrienne is unwell. She has a genetic disorder called Fabry disease. Because of it, she is often tired and in pain. Still, she keeps her spirits up. In this video and the following ones, Fabrienne would like to explain more about Fabry disease. First, some general statements. Fabry disease is genetic, meaning that in almost all cases, people inherit it from one of their parents. Either someone has it or not. It cannot be contracted and it cannot be healed. Still, it's a progressive disease. Even if someone has it from birth, symptoms might not appear until someone is 20 or older. Nature and severity of the symptoms can change, with symptoms usually becoming more and worse over time. Fabry is a metabolic disease. Fabrienne is unwell because the inner workings of her cells are disrupted. As almost all of the human body is made up of cells, almost all organs can be affected. Still, some organs are more commonly affected than others. Most Fabry patients have problems with either their hearts or kidneys, or nervous symptoms, whereas symptoms involving liver and spleen are not typical for Fabry disease. Fabry disease is treatable. There are, as of now, 2 different kinds of therapy. There are 2 preparations that are administered through a bi-weekly infusion, and the other option is a capsule that is to be swallowed every 2nd day. Not all treatment options are available in all countries. The goal of treatment is not healing, but alleviation of symptoms and slowing of disease progression. Now, what does this mean in practice? Fabry disease is infamous for being hard to diagnose. Clinical presentations vary greatly between patients. Some need kidney dialysis in their 40s while having healthy hearts, and others need an artificial pacemaker at the same age while their kidneys remain healthy. A full overview of possible combinations of symptoms would require interviewing all patients worldwide, which we cannot. So we'll stick to Fabrienne's story, which mostly aligns with those of her non-virtual friends. We'll first describe the development of her symptoms in her childhood and youth, and then we'll present an overview of the current state of symptoms. As a guideline, we'll use this chart of symptoms, which is a shortened version of a table from the paper mentioned below it. Some of the earliest symptoms Fabrienne experienced were gastrointestinal. She liked school, but frequent diarrhea made it a difficult experience. You have to go now? Then go. A lot of it has to do with different types of food. A bit of milk, a bite of a wheat bun would cause those problems for her. By now, she has her own personal diet, like every one of her friends has developed over time. But as a kid, it's hard to figure out. And try to explain to a teacher you have to go every hour. Relieved? Around the age of 10, she started developing the skeletal deformations mentioned in the table. This is what her hands look like now. It started with the bumps on the backs of her hands, which was a painful process. Handwriting was difficult for her in that time. Don't be ashamed of your hands. I made them look beautiful for this video. In her late teens, new symptoms developed, namely pain, exhaustion, and difficulty sweating. That last one might seem harmless, but hot days are hard to endure if someone can't sweat. Despite the discomfort, Fabrienne tried working as a saleswoman in a web shop, but as of late, her symptoms became too severe for that. On bad days, she can't even add 1 + 1 anymore. So now she's starting a new career, embracing her handicap. With her new diet, diarrhea isn't a problem anymore, but constipation is. Before today, when was the last time you could go? 3 days. The morphine makes it worse, but it's absolutely necessary for the pain. And Fabienne doesn't only feel pain without anything hurting her, there's also a lot she doesn't feel. The sensory nerves in her body are swollen near the spine and damaged near the tips, meaning she hardly feels her hands and feet. She often stumbles, making walking on uneven ground hard. She also often drops things. Her muscles are involved as well. Mainly it's muscle weakness, but sometimes the muscles controlling the blood flow through her fingers contract without cause, as evidenced by the white fingers on this photo. Another problem is brain fog. That means, for example, difficulty with concentration and short-term memory. I suppose you took your laxatives today because you forgot we were shooting? Because she often mixes up words, she can't do the voiceover herself. And then there's the fatigue. Because fatigue sounds like tiredness, some people don't like the word, but as it probably won't go away anytime soon, it's necessary to explain the difference well. Being tired is something one can ignore to a certain degree when it's absolutely necessary. Fatigue isn't. It's complete and utter exhaustion, an inability to actively do anything. So Fabienne spends a lot of her time in bed, and with enough rest, she has some 3 hours a day for her hobbies. On good days, that is. There's a lot she'd like to do, but she can't. It's not a matter of motivation or willpower. She's unwell, and she needs a lot of understanding and friends who support her. And because she has that, she keeps her spirits up. As for the other symptoms on the list, angiokeratoma are small red bumps on the skin. Fabienne has a few, but the typical image are clusters of those bumps, mainly between the waist and the knees. They are painless and don't itch, but they are easy for a doctor to recognize. Obstructive lung disease, like asthma or COPD, is 10 times more common in Fabry patients compared to the general public. Fabienne is also often short of breath, another reason she doesn't narrate these videos herself. Cornea verticillata means that a whirl-like pattern can be seen when looking into the eye using a slit lamp. Like angiokeratoma, this is of little consequence for the patient, but easy for a doctor to diagnose. Commonly associated with Fabry disease are problems with the heart and kidneys. Severe renal failure is possible, but it's not typical for the most common mutations. The same goes for cardiac hypertrophy, an abnormal thickening of the heart muscle. Luckily, Fabienne only has a mild cardiac and renal insufficiency. Stroke is common amongst Fabienne's friends, but Fabienne hasn't had one so far. Some of her friends have had multiple strokes starting in their 30s. Not included in the list, but most likely associated with Fabry disease, are high blood pressure and heart rate. Fabienne receives treatment for her pain and blood pressure, but no Fabry-specific treatment. For other diseases, drugs are often prescribed to prevent damage from happening, but not for Fabry disease. For this disease, treatment isn't started until irreversible damage can be detected, and often not even then. Two other important topics are inheritance and causes. Unfortunately, there is a lot of misleading information available online. That's why Fabienne wants to provide the necessary information to really understand these topics before delving into them. So first, we'll be doing a video explaining the inner workings of a cell, which will allow us to understand inheritance. And after that, we'll present a video about what's going wrong in a Fabry cell to explain the causes of this disease. We hope to see you there. Until then, feel free to write and have a wonderful day.